Okay. Hi, my name is Shai Chen, a third-year nursing student will begin my career in nursing. In this PowerPoint, I'm going to talk about nurses' experience of verbal abuse from patients to nurses in healthcare. This is overview of the verbal abuse. I will talk about background, objective, outline, and finally conclusion. What is verbal abuse? Verbal abuse is a key feature of the emotionally abusive relationship. Because nurses perform healthcare and treatment to patients directly, they experience verbal and physical abuse for a variety of reasons. In particular, nurses suffer a very high levels of violence. A correct study indicated that nurses were experiencing non-physical attract and 36.4% were physically attract. Nurses experience verbal abuse from patients in their daily work, most of it gendered and sexualized, especially some nurses who have not obtained enough work experience. For example, new licensed nurses have a high risk of suffering to violence when they just transition from university to practice. The verbal abuse has a high breaking effect on the nurse. It will damage nurses' sense of self-worth. Whatever as professional and as a woman, verbal abuse can produce various negative reactions in nurses. For example, it will lower the degree of satisfaction, reducing the quality of services provided to patients, even increasing the turnover rate. For this difficult problem, leadership should take everything into consideration, balancing patient with nurses and solve it. Therefore, in order to prevent verbal abuse and reduce the emotional response of nurses, it is necessary to develop communication skill, draw up preventative education programs, and plan to effectively respond to verbal abuse. Healthcare professionals obtain lots of medical risk when supporting healthcare service to individuals and communities. Healthcare workers, especially nursing staff, are most often the target of violent behavior among mental health patients. In 2013, Slovenia conducted extensive research on employee violence hospitals, nursing homes, special education, work and care center. After investigation, a total of 92.6% of respondents indicated that they had experienced verbal behavior from their patient in the past 12 months. Patients with similar mental disorder are more likely to engage in irrational behavior. For example, nursing workers employed in nursing home more likely to suffer violence by the patient with autism. Verbal abuse is not only a challenge in graduate nurses, but also an emotional burden plagues them. Although they have experienced intermittent placement in hospital during 3 years in college, inevitable, short of enough work experience, often becomes the reason of the verbal abuse from patients. It is a huge negative impact on their personal life and professional career. When occurring the behavior of verbal abuse, new graduate nurses have to appraise the patient will ask for help from senior and leadership. At this time, leadership should properly deal with the relationship between patients and new graduate nurses. So in a healthcare service which focuses on functional and well-being improvement, the appropriate communication process between patients and professionals is crucial. In mental health environment, Therapeutic communication is a key ability required to develop successful nurse relationships to determine patient requirements and mental health issues. The effective communication includes introduce self to patient, greet others appropriately, listen carefully, and is sensitive to patient, provides clear instructions in all activities. Nurses use treatment communication skills as an intervention to help the patient set and achieve goals, ultimately achieving health well-being. It is recommended to import a nurse professionals training program to improve communication skills for solving conflicts between nurses and patients. In addition, the country should provide an environment that includes resources that help improve effective health service. Look at this poster that is come from a nurse staff room. If you have been assaulted at work, if your employer does not take steps to prevent further assault, please contact the number or email or complain to police. Until now, it is a large number of studies from around the world of the workplace violence of a patient for healthcare workers in all areas of nursing care. As far as public health authorities are concerned, they have demonstrated serious concern at non-fatal violence against healthcare workers. In 2013, the United States reported workplace violence incidents, which 74% occurred in healthcare institutions. Healthcare workers were measured by workplace violence treatment that reported the prevalence of verbal abuse, taking up more than half of healthcare workers. Healthcare workers are at a very high risk of verbal abuse in their daily work. Both nurses with long-term working experience and new nursing graduates have to be paid enough attention on verbal abuse. Leadership needs to do more support to help nurses when caring for abusive patients, such as better legal protection when reporting workplace violence and more workplace training, including how to respond. Increasing hospital security is of the utmost significance to protect nurses in the nursing care setting, an environment prone to violence. Ideally, through more effective workplace violence interventions and reporting procedures, the information can provide the evidence to guide a safer work environment, thereby resulting in fewer injuries and treatment-related causes. Conclusion: although verbal abuse does not cause obvious trauma such as physical abuse, it can make more serious. Plenty of studies have shown that abusive patients occur a variety of negative reactions, including embarrassment, shame, and fear, and also feel pressure and burden at work. In this case, verbal communication and verbal abuse can have a multiplier effect on these negative attitudes and ultimately lead to unemployment and quote. So leadership should assist nurses to develop communication skills, draw up preventative education programs, and plan to effectively respond to verbal abuse. This is reference list.